Good afternoon and welcome to the Plymouth Noon Zoom COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we have been here during June on Mondays and Thursdays at noon for this update. Each of our updates are date stamped in the top right-hand corner, so you'll know that it is current and contemporaneous when you're watching it. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15, Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. Today, for your questions, please email us to plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Today's participants joining Ken Tavares, Matt Muratore, and me include Dr. Phillip Triffletti, Dr. Mark Wilson, Christopher Smalley, who is the Senior Director of Marketing Communications, Beth Israel Deaconess, Dr. Gary Maestas, Robert Eisenstein, Senior Living Consultant, and Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. We're going to begin with the Chair of the Select Board, Ken Tavares. Welcome, Ken.
Thank you. Good afternoon, everyone. Just a couple of brief announcements. The first is I want to remind the community that if you have deferred any tax payments, they are due on Monday. If you pay on Monday, then you will be, you can forego any interest or penalties that might have normally come with the delay. So please, don't forget Monday is the deadline. Also, I received word this morning that the traffic flow in the center of town is starting to change. Remember, we are accommodating businesses in the center with the new barriers, and there'll be various streets will be closed or made one way. It will be fairly easy to follow, and we're looking forward to seeing how this experiment is going to work. Thank you, Steve.
Thank you. That's Ken Tavares. He is Chair of the Select Board for the town of Plymouth. Again, a reminder to all of you who are watching, Plymouth's special and annual town meeting is scheduled for Monday, August 10. It is being done through a Zoom webinar platform along with a V-Voter platform from OTI. Last night, the Advisory and Finance Committee met, and after discussion for over an hour, the Advisory and Finance Committee voted unanimously to support the virtual town meeting proposal through the video conferencing platform. You'll continue to receive more information as we roll out the training during July. The first training is going to be with the Committee of Precinct Chairs on July 9 at 7 p.m. And after that training, they will have their monthly meeting. Finally, I did want to communicate to the community that under the statute, people in the community, registered voters, may participate at the virtual town meeting. However, it is necessary to file a written request with the town clerk at least 48 hours in advance of town meeting. If you have any questions, certainly you can contact me as the Plymouth Town Moderator, and for those of you who do wish to speak at the special and annual town meeting, you're to notify the town clerk in writing. At this time, we're going to continue with our health segment, and we're joined today by three members from the health community. We're going to begin with Dr. Phillip Triffletti. He is an attending primary care physician, Beth Israel Deaconess. Welcome, Phil.
Thanks, Stephen. Glad to be here again. I'd like to just get started by discussing some questions that come into my practice as a primary care physician. So I got a call from one parent this week, and he said his son was out on a boat with 10 kids. And one of the girls that came on the boat had a sister who actually was found to have COVID-19. And the girl actually had tested herself, got a test before she went on the boat, and was thought to be negative. And then they called me to ask, what do I think about the risks of having this girl on the boat. They called me about a day later and said that the girl who was on the boat. Unfortunately, the second test came back positive. So then, I advised, of course, that their son, self quarantine at home, and he was actually being tested yesterday. I don't have the results yet, but I think it goes to show, some of the complexities of, trying to protect one another. The first thing I would just say is that, congregating 10 people on a boat, probably, fairly close quarters. I don't know if they were using masks or not. Outdoors is always probably lower risk, but, there probably are, some risk when you congregate in this matter. And then the second thing I wanted to bring up about this case was, how difficult it is to rely on tests because, the tests are not perfect, they're not 100% accurate. Doing a little further research without getting too technical, there are different types of tests for doing testing for the virus, particles. And so, the test is felt to be the most accurate overall in terms of, finding infection would be what is referred to as a PCR test or polymerase chain reaction. And it's also sometimes referred to as an NAAT, which stands for nucleic acid amplification test. So those types of, nasopharyngeal swab tests are the best. If you're getting a rapid antigen test, those ones we believe tend to be a little bit less accurate. So I don't know if this girl originally had an antigen test followed by the PCR test, but I believe that may have been what happened. And then interpreting the tests, it turns out if you test somebody on the first day, the likelihood of it being positive is about 0%. If you test them about 5 days into infection, then you have about a 62% positive rate. That's good, but it's just slightly better than half. And then around day 8, about 80% of people who are infected will be positive on the PCR test. And then once you get on the back end around day 21, about 44% of people will still be positive. And as we've mentioned before, sometimes on the tail end, people might still have measurable amounts of virus, but probably are not infectious at that point. So the problem, of course, is like with this scenario that I described was, you may have trouble, even if you're testing, which I think is a great thing to do to minimize risks when tests are available. You might still be getting false negatives with these tests, depending on where you are in the course of the illness. Too early on, you'll miss it. Later on, you have less of a chance. But around a week or so is probably your biggest opportunity to get the test to be positive. Then other kinds of questions I get questions from grandparents. Should I be around my children? Should I be around my grandchildren? And I do actually recommend if people want to take that extra step of caution and get tested, at places like Walmart where you can be tested without a doctor's order, and if you're asymptomatic, I think that can add an extra layer of safety, especially for grandparents when they're, some of them are in their 70s or 80s that call me, or they might be on a medication that puts them at risk, an immunosuppressant drug. So I think those are different ways to minimize your risks. I got another call from a family, a dentist and his wife, and the wife was quite concerned about, having him in the household and, how should they deal with him in the household. He's taking great precautions in his dental practice, which he reopened about a couple of weeks ago. And that's another case where, I think that, perhaps doing routine surveillance testing, even in his own practice of himself and his staff, might be an added layer of safety that he could consider. And as I mentioned before, when you go in the hospital for an operation or procedure, they'll test you 2 days before. And, he may want to also consider doing that in his dental practice, although, there is a cost associated with this, obviously, if you decide to do more surveillance testing. Now moving on to just how things are going in Massachusetts. I thought it was very interesting. I think the governor mentioned that when they had opened the pop-up screening testing for people who had been participating in protests, I think they tested about 17,000 people, only found about a 2% positive rate. So that was encouraging to see that the numbers there were low. And I think if you look at our curve on tracking the curve, I mean, we have really come down a lot. We're doing wonderfully, still with very low numbers of new cases each day. you may have heard in the news that up in the Northeast here with the collaborative between New York, New Jersey, and Connecticut, that they're actually going to start imposing quarantines on people coming into their state if they're coming from these states where they're having surges like Arizona, Texas, Florida, et cetera. So, I think that these are things that when we're in a situation like we are in Massachusetts and other places in the Northeast, and you've got low numbers for community spread, we may want to look more at people who are traveling into the area and trying to make sure that these people are not infected. Another thing that was noted recently this week about Massachusetts was that we seem to have a very low, what's called a reproductive factor, sometimes referred to R0. And, if you're below 1, that means that for each person that gets infected, less than one person is being infected by the person who is infected. I believe in Massachusetts, our reproductive factor was probably around 0.62, somewhere in that range, low. In other parts of the country, it's over 1. So that means for each person infected, more than one person is getting infected. And so that's still another number that I think is very encouraging overall. And then the last news items I thought that was of interest this past week, which is not a real big surprise, but it's nice to have more data. There was a report in the media, when they were looking in March about how many people were infected, they found that when they studied the number of total infections in the United States in the month of March, it was about 8 million people were infected. The problem was that we only measured about 20% of these people were actually found to be infected, and the other 80% were not diagnosed with their illness. So, oftentimes I think, epidemiologists, wonder how much extra infection is actually out there in the community that we're not measuring. And you can see that, perhaps, a factor of 5, 5 times as many people are infected than what you believe. So, so that's something always to keep in mind, I think, when you look at any of the numbers that are being reported, whether they're national numbers, state numbers here or elsewhere, other global numbers, is that a lot of the numbers that are being reported, that's just the actual measured cases that we know about. And that's probably in some ways just the tip of the iceberg. It's probably quite a few more people that are actually infected in the community. And we have to keep that in mind as we go forward and continue our mitigation strategies. So that's all I have to do for starting off. And as always, I'll be eager and ready to answer any questions later on in the broadcast. Thank you, Steve.
Thank you, Dr. Phillip Triffletti, attending primary care physician at Beth Israel. You can send him your questions to PlymouthInfo@pactv.org. And he references the fact that epidemiologists wonder certain things. And we have our own Plymouth epidemiologist, Dr. Mark Wilson. Welcome, Mark.
Thanks very much, Steve. It's great to be with you all. I thought I would start with some new reports that appeared since last week and share with the viewers some insights from them. The first one has to do with a scientific research report that was published involving the CDC, and they released this report on the demographics and comorbidities of confirmed COVID cases, hospitalizations, and deaths. The analysis was of data that were compiled from the end of January through the end of May on about 1.7 million infections and about 103,000 deaths. So this is the CDC gathering these data and then analyzing them from, these are data gathered by each state and territorial health department and sent to the CDC. Most striking finding from this report that I could see was that patients with underlying health conditions such as heart disease and diabetes were 12 times as likely to die of COVID-19 as otherwise healthy people. We've heard a lot about this in the news, the risk factors for increased morbidity and mortality. But those underlying health conditions increase your risk 12 times that of those who don't have such conditions. They also reported on race and ethnicity. And again, we've heard a lot about this. And they used data on nearly 600,000 COVID illnesses and showed that 33% of the cases were Hispanic, although Hispanics comprise only 18% of the US population. Similarly, 22% of the cases were Blacks, yet Blacks constitute only 13% of the population. And even for Native Americans or Alaska Natives, 1.3 were represented in this data set of illnesses, and that's really twice what their population is at risk. So this clearly documents that race and ethnicity are major factors, and minorities are at much higher risk. Another part of this report, in this case using hospital surveillance data, show that much higher hospitalization rates for minority groups also were shown. And in this case, on the order of 4 to 4.5 times higher hospitalization rates for these minority groups. And of course, we all know that elderly people in general tend to be at higher risk of infection and of severe disease. I mention this in the context of what we're seeing in the way of especially young people who are not following the recommendations for reducing risk. These are the people who don't have, many of them don't have these risk factors. Many of them are young, they're white, and sometimes often privileged. And I guess the point I want to make is that we need to remember to encourage them to practice prevention, keeping in mind that prevention is affecting our health, not just their own. I think there's a certain selfishness to the way in which we think about masks, when in fact, really it should be us thinking about distancing and mask use as a way of protecting our family and our friends and our neighbors, and not just ourselves. The next report I want to present, this may be what Dr. Triffletti was just talking about, but I'll give you a little bit more detail. We know that these lab tests that he referred to, PCR lab tests, they're used to examine samples, and they amplify parts of the genome of the specific virus that causes COVID, but only if that virus is present, obviously. And so because of the limited test availability, the false negative rates that we've heard about, the fact that people are asymptomatic or subclinical and very oftentimes don't get a test even if they had one available to them, there's enormous undercounting of this true prevalence of SARS-CoV-2 infections. So the true amount of infection really is difficult to measure. This new report analyzed national surveillance data that were gathered again by the CDC, but not on COVID, on influenza-like illness, ILI. And they used this to estimate the true infection rate for COVID, for SARS-CoV-2 virus. And it's an interesting and I think very creative use of ILI, influenza-like illness data. Influenza-like illness can be caused by many microbes. It's very often influenza virus, especially during the winter. We know that, but there are many other agents that can cause the symptoms that involve cough, fever, headache, and so forth. This new report analyzed non-influenza ILI, influenza-like illnesses, and compared it with the seasonal average during March. This was data that were available during March 2020. And they demonstrated that there was this surge in ILI, influenza-like illness, that correlated with the COVID cases that were observed across the whole United States. And if they then assumed about a third of patients truly infected with SARS-CoV-2 in the US actually sought health care. This surge represents an underestimate of the true number of infections. And the analysis, which appeared in a very prestigious journal, Science Translation Medicine, so this is really very noteworthy for that reason, underwent very serious critical peer review. That estimate was of 8.7 million new COVID infections during the month of March, a huge underestimate of what was actually measured. And so I think what we want to do then is think about the proportion of people who were actually becoming infected, and their estimate was on the order of 80% of infected patients never were detected. So the good news from this is that there may be many more people than we imagined who have been infected, who have mild or no symptoms, who never were counted, and may be protected to future infections. So this is actually a very positive note that we can keep in mind from this result. But it also emphasizes the need for continued and better testing, and now increasingly of a test that would determine antibodies. Once infected, you produce antibodies. If tests for antibodies were perfected and made more available, we'd have a much better idea of the R0 that Dr. Triffletti just referred to, the proportion of the population actually available for infection who are not protected by antibodies from preceding infection. We'll need to know more about this until we get a vaccine. Another report that I'll briefly mention, it's entitled, "Does Density Aggravate the COVID-19 Pandemic?" And the basis for this question, if you will, is that densely populated areas may lead to more face-to-face interactions, and these then could increase risk of airborne transmission of COVID virus. On the other hand, densely populated areas may have better access to healthcare facilities and maybe even greater implementation of social distancing policies and practices. So this was a modeling study that evaluated the direct and indirect impacts of population density on COVID-19 infection and mortality. And the group who produced this report analyzed 913 metropolitan counties in the United States, and they used the metropolitan population of each of those counties as one of the important predictors, and they found that this was the most significant predictor of infection rates. And in general, that larger area metropolitan counties had higher infection and higher mortality rates. But then they controlled for, statistically, they controlled for population in these areas. And they found that county density, the density of people in each county, was not associated with infection rates. And this may be due to all sorts of things, possibly to adhering more to social distancing and many other factors. So interestingly, counties with high densities have significantly lower COVID mortality rates. And this may be due, in turn, to a better healthcare system. So the point of this is that the simple assumptions that the more densely populated an area is, the higher the risk, may not hold. And in fact, the takeaway message, if you will, from this work is that really it's interpersonal connectivity is what matters, much more than population density per se. And so in large metropolitan areas with a higher number of counties that are tightly linked to each other through economic and social and commuting relationships, these are the ones that are the most vulnerable. And they are most likely to exchange tourism and business people who are moving around and so forth. And so these kinds of social exchanges are what's driving transmission rather than simply the population density. But I'll stop there, and again, I'd be happy to answer any questions that might come up from the viewers. Thanks.
Thank you, Dr. Mark Wilson. He is a active professor emeritus, University of Michigan School of Public Health, Department of Epidemiology. And each day we have a health segment because this pandemic is a health and public safety issue. And in order to help officials and members of the community respond to the coronavirus, we're bringing in experts to help all of us figure out how we respond appropriately. And our next guest is from our local hospital. Christopher Smalley is the Senior Director of Communications and Marketing at Beth Israel Deaconess at the Plymouth campus. Welcome, Chris.
Hello, Steve, and hello to all the other members on this final broadcast, I believe, for you. And thank you for allowing us to come on to present information as it becomes available at the hospital. Like what Dr. Triffletti said earlier on the broadcast, we too are beginning to see the numbers of COVID positive patients and suspected positive patients come down significantly since the last time that I was on this broadcast a couple of weeks ago. So we are seeing that downward trend. At the same time, we're still looking ahead and planning for a secondary surge, which could happen. And it's wise for all healthcare organizations to be, planning for that. Related, a couple of weeks ago, as we all know, the state opened up phase 2 of the Commonwealth, and we also opened up or resumed caring even more for patients. We never closed, but we are now open for elective surgeries and procedures. And so there's a lot of behind the scenes work by several groups at the hospital, clinical teams and non-clinical teams that are looking at, our facilities, infection prevention and control procedures, personal protective equipment. How do we reopen or restart, a hospital that was pretty much in surge mode for about 3 months? There's plenty of safety measures at all times at a hospital, and even more so right now during COVID-19, and those will continue, obviously, for the foreseeable future. One thing that we are looking at as it relates to patients who are coming in for elective surgeries, there's a priority schedule that's being developed for those non-urgent elective surgeries. So if you're on that priority schedule, you'll have your surgery first, and then it would follow. If you're not a priority, you would come in sort of second, if you will. As people do enter the hospital, we have several entrances, but we're only allowing 2 or actually 3 for the general public. That's the one off of Obery Street, there's one off of Sandwich Street, and obviously our emergency department entrance. And the flow, like any other business in town, has been restricted greatly, because we do have to adhere to social distancing, et cetera. So it does take a little bit longer for patients and their visitors to come into the hospital, because everybody is checked or screened for COVID-like symptoms. And obviously, everybody has to wear a mask at all times. The biggest question that we're getting from the community is, what about visitation hours? So we do have some modified visitation hours that have been in place for about 2 weeks. Right now, visitors are allowed between 11 a.m. and 2 p.m. and then again from 4 p.m. to 7 p.m. They will be screened when they enter. If there's a patient that's on respiratory precautions, most likely they will not be allowed to have a visitor come and see them, but that would be determined by the nurse at the nursing station. All of our outpatient or ambulatory patients that are coming for a treatment for the day or an appointment at any of our on-campus or off-campus locations, they're allowed 1 visitor, but that visitor can only escort them to the appointment, and then they would have to exit the building because we have to maintain social distancing in all of our waiting areas. If there's space available in a waiting room, then a visitor or a patient escort could stay there. Couple of last sort of big items here. Telemedicine. Many people are now hearing about that and reading about it. This is something that all of our specialty offices continue to offer. And I suspect that this will probably be a new wave of sort of a first look at preventative care moving forward, where an individual can most likely contact their specialist or primary care doctor for a telemedicine or a telehealth visit. So we encourage people to go to our website, BIDPlymouth.org, to find out more about telehealth options at the hospital. Also, all of our blood drawing stations are open, but they're open by appointment. So you'd have to call ahead or have your primary care doctor or specialist schedule that for you. And just in closing, we are screening everybody. We just ask for people's patience as they come to the hospital or the outpatient locations. It's going to take a little bit more time. That's the new normal. And that's no different than any other business that's reopening here under phase 2 of the governor's opening. And also a big thank you to everybody with the town and state government for all of their incredible work that they've done in the collaboration with our hospital to make sure that the residents of Plymouth truly are safe during this pandemic and continue to be safe as the pandemic evolves until we have an effective treatment or a vaccine. Obviously, happy to answer any questions at the end related to the hospital. But again, thank you, Steve, for allowing us to be on your program.
Christopher Smalley is the Senior Director of Marketing Communications, Beth Israel Deaconess. Please send your questions to PlymouthInfo@pactv.org. And at this time, we welcome once again Dr. Gary Maestas. He is the Superintendent of Plymouth Public Schools. Welcome, Gary. You've had a busy time.
Yes, Steve, thank you for doing this, and once again for a great information session for the community of Plymouth. We have a number of updates to share today. Last night, the Commissioner's Office sent out an update on guidance on what our schools need to prepare for the school year upcoming, the 2021 school year. And we have a number of things that we have to prepare for. The key features that we have to do, we have about a month to prepare this, is we have to prepare 3 plans. One plan would be a full student population school where all students were back. The second option is looking at a hybrid model where we would have some students coming to school, some students being taught at home or vice versa. And the next option would be a full online learning module options that we've had the last few months. So we are going to be working diligently with our administrative team. We had some preview of this information a couple of weeks ago. So my team, principals, coordinators, and directors across the community have been working on defining what that looks like in schools. The biggest feature that we were waiting for was the whole concept of spacing and proximity of classrooms, and the guidance as of today indicates that there's significant research out there, and some of the panelists probably have an opinion on that 3-foot distance from student to student is going to be the guiding factor, and students from grades 2 and above will be required to wear masks. So there's some level of concern, kindergarten 1 with students of that age being able to manage that, especially preschool and kindergarten students who that will be in many cases their first time in a structured environment. So that is the guidance. We have a great deal of work to do. We also do not have guidance yet on transportation because that's one of our greatest concerns, is how do we maintain that distance between student to student on our bus runs, which our elementary runs are very, very crowded, and we're concerned about that. So we have a lot of work to do, Steve, and I know there are going to be a lot of questions to our community, from our community, but our plan moving forward is to submit the 3 options to the Department of Elementary and Secondary Education. I want everyone to know out there that they're going to look different from school to school, because square footage in classrooms are different in Massachusetts. I think here in Plymouth, we're fortunate. We've done some preliminary work that we can probably function with having the capacity, majority of students in our buildings at capacity that the Department of Education is looking for. So we're going to be doing that. We'll be doing the exercises behind the scenes to make sure we can do that. Our classrooms are going to be cleaned, and we're going to make sure we have as much square footage as we can as we move forward with this. But it's going to be a busy summer for the school department. So back to you, Steve.
Thank you, Dr. Gary Maestas, Superintendent of Plymouth Public Schools. You can send them your questions to PlymouthInfo@pactv.org. Today is the final Thursday update for June. We'll have one again on Monday, and then throughout the summer, we will have updates as needed, at least once a month, and we'll certainly be inviting back Dr. Maestas to update us as the school year approaches. At this time, we're going to continue with Robert Eisenstein. He's a senior living consultant. Welcome, Bob.
Thank you, Steve. My report's going to be relatively short, but I did want to pass a few comments similar to what Chris said. I just wanted to give a shout out to you, Steve, and PAC TV. And this is such a wonderful presentation that we've had. I've just listened to Gary Maestas. I've talked to my friends and colleagues, all over the country, frankly, and the fact that we're giving this information out on a daily basis through this forum with experts from throughout the field, not just healthcare, I just want to tell you, it's a fantastic testament to the strength of our town of Plymouth. So congratulations to all my fellow panelists. It's been a pleasure to be part of it, Steve. It really has. So getting right into the nitty-gritty for nursing homes, the numbers are continuing to really decline in an excellent fashion. Week over week, the number of new cases, the total number of positive cases throughout the state is 23,297. And that is only an increase of 365. And that's down from, we were averaging 400 to 500 to 700 cases increase week over week. The really very positive news is the total number of new deaths, meaning people who passed away in the last week, is 132. And that's half of what it was before that. That was about 204. So, you know, exponentially, it's really, everything is really moving in the right direction. That's the good news. And we've talked about this week over week in terms of the nursing home. I did want to talk a little bit about, there was a report that came out on the Soldiers Home in Holyoke. And unfortunately, people who are going to read that, the public in particular, it's a scary report. It made it sound like there were things that were missed. There were things that weren't taken care of in terms of infection control. And so that's the bad news. I just wanted to reassure everybody that unfortunately, based on crises, comes out some very good practices. And right now in all the nursing homes across the state, I think the message that we've learned is the devil's in the details, and you have to jump on that first positive case immediately. And I think all of us in the nursing home field in particular, and I think the doctors would echo this in terms of the public. That's why I'm so proud of our state in terms of reinforcing the use of masks and precaution. In the nursing homes in particular, I think the mistake that was made there was within that first 2 weeks, unfortunately, there were some bad decisions made. They did not have infection control specialists on site to really know how to cohort and isolate the infected cases. Today, what we're doing in every single nursing home, I'm actually in one today. I'm doing some temporary work covering in a nursing home. We are COVID-free. Any new patient that's going to come in from outside of the nursing home has to be tested rigorously, has to have 2 negatives, has to be symptom-free. And on top of that, even if they're negative, we use 2 different terms. We either say presumptive or unknown. I like the term unknown a little bit better because we don't know whether they're infected or not. They could be asymptomatic. But we put every single one of those patients in an isolation room with a 14-day quarantine, and with staff having full PPE for that specific patient. So that is a lesson that I think, you know, unfortunately we had to learn it the hard way, but we're all learning that. We now call this a clean facility. We've been clean since June 2nd, I believe, in this particular facility. So there is good news around. The other thing I wanted to point out, the increase in positive cases, there was only actually one additional nursing facility that was a new facility that didn't have positive cases compared to last week. It went from 368 to 369. So we're really stopping this. I think what's happening is we're trying to sustain the successful outcomes that we learned. And, you know, there's a term that we're using. We're going from audits to action plans. And we've done a series of 3 comprehensive infection control audits. All the nursing homes have gone through that. And then there's been an additional 4th audit that is done by the federal government through CMS, Center of Medicare and Medicaid Services. And once those are complete, for example, in this facility here, we have an action plan that we have to implement. There are a few little things that we have to correct, but in general, we're all receiving positive scores. We're becoming much more rigorous in how we treat any new patient coming in. And the visitation restrictions are also changed. For example, when I came in this morning, every day, they know me, but every day I have to get my temperature taken on my ear. I have to sign a waiver that I haven't been in close contact with anyone who is known as a positive case. I have to reinforce again daily. I have to sign an affidavit. So unfortunately, I think this is the reality of what we have to do now in nursing homes. The other thing that we are going to get into, and Matt would know more about this as well, there was a House amendment just passed that's going to hopefully provide surveillance testing amendment to establish state-funded adaptive for nursing facilities so we can really do surveillance testing, have a program on a permanent basis. So those are going to be the challenges we're going to have to deal. We're going to have partnerships with the state government to provide funding. Everybody's already asking about this. How often should we do testing on a regular basis? How are we going to pay for it? How are we going to pay for protective, PPE equipment on a regular basis? Because it is, there's a cost involved to all of us. So it's a very positive number, but I also did want to point out that negative report about the Soldiers' Home, why that happened and what we've done to make those corrections going forward. So again, I'm open for questions, and Steve, thank you very much for inviting me to participate in this forum.
Thank you, Robert. Eisenstein, Senior Living Consultant. Please send your questions to PlymouthInfo@pactv.org. We're going to write to Stephen Cole. He is the Executive Director of Plymouth Regional Economic Development Foundation. Welcome, Steve.
Thanks, Steve. Glad to be here. I just want to echo some of the same comments that you've already received and further sing your accolades. Thank you very much for this opportunity, and thank you for letting the foundation be a part of it. I hope that we've transmitted some important and meaningful information over the last, 20 or so appearances. But, listening to our doctors, frankly, I got to say, I always learn a lot when I'm here. And I don't know what I'm going to do without you guys. I hope I don't get sick. But the fact of the matter is I'm always marveling at how the things our doctors say coincide with the things that I've prepared my notes to reflect. And it's just frankly demonstrative that good public health policy is in fact good economic policy. And that's the world we're living in now. So, just kind of jumping right in, there's some good news in the marketplace. There's some bad news in the marketplace. The markets are underperforming. There's some iconic businesses that are closing. But some good news is that the manufacturing, which was at a 10-year low at the start of all this nonsense, it's starting to actually recover. And we can actually see a almost 16% increase in durable goods. That was expected to actually perform at about 9.8%. So you can see huge seismic jumps in certain important indicators. I want to reflect on what we can expect, because frankly, what we could expect prior to all this was a recession. We actually were talking about a recession in the industries, finance and insurance, prior to all this. And in fact, what we now know is that we were actually in a recession starting in February, about 6 weeks ahead of the lockdown. The fact of the matter is, in 250 or so plus years of the country, we've never gone more than 10 years without growth after a recession without some kind of an impediment. We've been over 10 years already. So when you consider where we were in 2008, we're already in 2012. We've actually had one of the longest economic expansions in our country's history. So this was in some ways expected. How long it goes, how deep it goes is somewhat a consequence of what I mentioned earlier, whether or not we have good health policy, public health policy in place. We are well positioned. I've said this countless times over the course of the broadcast. We're well positioned for a recovery. Prior to all this, we were looking at 2% vacancies in the housing market. 4% of our population in the county was what we regard as poverty. 2.8% unemployment. We have large lots, low density, high quality of life, excellent schools. Thank you, Dr. Maestas. 30 miles from Boston, and we're proximate to Cape Cod and Providence. Coming from Boston, you can save yourself a good hour or two in the summer trying to get to somewhere else across the bridge. So, we have a lot going for us. And part of what drove our recovery prior to or after 08 rather was that we had a lot of investment from outside states. There's only 20 towns out of 169 in Connecticut, for example, that have actually recovered their property value prior to 08. That's one reason why we see a lot of Connecticut plates, frankly, in our area. And I'm a little distressed when we see some of the negative comments about our visitors on Facebook. I understand some of the concerns. Dr. Wilson's comments are very well received. I mean, it's true that some of our higher density areas actually have lower death rates, but we are going to start to see some of our cities start to vacate, if you will. We saw cities, urban areas start to regain population. They had fallen precipitously since the 70s, right? We saw these population growth start to happen partly because millennials didn't have those types of opportunities for them when they graduated in 08. So center cities started to regain those populations. Well, millennials, present company included, we're starting to act a little more predictably like humans. We're starting to flee certain urban areas, and we're looking more towards suburban areas to buy homes. Nationally, May home sales were actually down about 10% from April last month, and they're down about 26% from May 2019. In Mass, that number is actually significantly higher. It's actually 44% down from last May. The Fed Reserve, in fact, has said that they estimated about $1.5 billion in mortgages and rents are at risk. Right now, we've got a gravy train until the end of July. We'll see what happens when the Benefits CARES Act kind of dries up. But the fact is that out of the $1.5 billion in mortgages and rents in New England, it's pretty evenly split between how much is owed in mortgages, how much is owed in rents. The market is about to become unstable at a time when cities are emptying out, millennials are aging. The state, of course, has an aggressive housing strategy to meet demand. Even prior to this, they were expecting 600,000 new residents in the southeast of Massachusetts by 2030. And the state was forecasting that they had to build at least 17,600 units of new housing every year just to meet the demand at that time. Well, frankly, 60% of people are reporting a preference for telecommuting, which means that people can more easily access cities without being in the city itself. Places like Plymouth will be very attractive to investors. And I'll leave with these comments, the PREDF, colloquially the foundation. We're working to diversify the town's commercial and industrial portfolio and broaden the tax base. We're aggressively going after grants that lay groundwork for shovel-ready investments, as specific as grid-scale energy storage and as broad as launching, a brick-and-mortar center for, supporting entrepreneurial activity in Plymouth County. We know that, if it means to be good hosts during tourism, we're going to see a lot more folks moving into our area, I forecast, over the next several years. And this is on par with what we were seeing with the state. So I know we see some businesses closing. I know we see some negative trends in the marketplace. I think that Plymouth is very well positioned for a recovery. And so I would just say that the rumors of our death are greatly exaggerated. I see some smiles from members of our panel, and so that our remedial Republican representative doesn't miss it, that was in fact our Mark Twain quote for today. And I would say that remedial is, I'm using the first definition in the Merriam-Webster dictionary, not the second. So I'll leave it with that, and thank you, Steve, for the opportunity to be here.
Thank you, Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. Plymouth Representative Matthew Muratore, this is update number 61. You've been here since the beginning. How would you like to open today?
Well, I do like to open and say I am going to miss those Mark Twain quotes. So I may have to just ask Steve to text me one a week to keep up with that. So, but no, seriously, Steve, I thank you and I thank PAC TV for bringing these to the viewers. I know we have one more coming up on Monday, but all the panelists that have been on here, both Dr. Wilson, Dr. Triffletti, giving the updates, and as Stephen said, I learned so much as well. I try to take the numbers from the state side, but then you take it from the practical side of it, and it just makes a lot of sense, how we've been doing things here in Massachusetts. And I do also appreciate, Chris, Smalley, and the BID, what they've been going through. It's been tremendous what that hospital has done. I was looking at the numbers today, and it looks like they're down below 20 COVID cases now, both confirmed and unconfirmed, with only one in the ICU. So to where you guys were, it's amazing what you've done. So I thank you all for for being on. And Bob, I'll see you daily, but you brought some great insight to this programming over the last several weeks with regard to long-term care. And that report from the Soldiers' Home was gut-wrenching, as the governor said. It was hard to read. We know that's not how nursing facilities are operated. And it's good to have folks like you, Bob, and other experts out there fighting for the folks that really need the fight. And we will see more funding for it as well. So, and talking about funding, I want to comment to what Gary had to say. I was just listening to the governor and the Commissioner Riley talk about what Gary was just talking about as well. There is also going to be an additional $200 million in grants coming out to the school district as well, to help them with this, with this monumental task. But it was comforting to hear them say how these three plans for the school districts were developed in heavy consultation with the medical community. So it was, this wasn't done in a vacuum. It was done very well thought out, with keeping children in mind, both mentally and physically. And there will be more guidelines to come, but it's good to hear that there's going to be an additional $200 million on top of the $500+ million that came out at the end of May, and $194 million that came out in April as well. So, and I'm sure there'll be more money coming for the school districts as well. And I'm sure with more guidance coming out from the state, I'm confident with Gary and his team that Plymouth will be superior in the school realm for our students this coming year. With that said, I only want to add a couple more things. The numbers, again, continue to look really well. We are now at 1.8% of those tested are being tested positive. So we're really getting down there. 91,404 have recovered fully from the virus. There have been 7,938 deaths. And as Bob indicated, 63% of those have come from the long-term care facilities. We've tested we're almost at 800,000 folks tested at this point, 790,223. We're gearing up to be testing 30,000 plus folks a day. And hopefully by the end of the year, about 45,000 folks per day. So testing and tracing continues. I thought in Plymouth County, we had, there's been 8,610 cases and 651 deaths. And in Plymouth has been stable. Town of Plymouth has been stable for the last few days. It's at 602 cases with 69 deaths, but no changes over the last several days. I thought it was interesting too, in listening to Commissioner Riley talk with regard to the education. You know, the children have not really been affected by this, or if they do get the COVID, it's not as strong as it is for somebody that's elderly. When you look at the amount of people that have died over the age of 80 years old, 98% of everyone has had underlying health conditions, but 62% over the age of 80 have passed away from this. Compared to when you look at anybody under the age of 20, there's been zero. When you look at the ages 20 to 29, it's 0.01%. So it's really elderly people, people that have underlying health conditions, which is why we continue to tell people, if you have underlying health conditions and you are over the age of 60, avoid crowds, stay 6 feet apart, no physical contact, and if you can't stay 6 feet apart, wear a mask. You know, that's how we're going to continue to get through this, like we've been doing it. So continue with that. A couple of small things, as Bob indicated, there was a financial package of $1.1 billion we passed in the House for COVID-related expenses. It's anticipation of the FEMA Federal Emergency Management Agency's funding that will be coming to the Commonwealth. So we've expended some money for cities and towns. There was, I think, Ken, I think there's about $50,000 in there we put in for technology for the town of Plymouth that could be used for the town, the school, et cetera. We also did pass a tax holiday as well. I'm sorry, the governor approved a tax holiday. We approved this tax holiday back in 2018, but the governor has just designated August 29th and August 30th as a tax holiday for any items under 2,500, but it does exclude meals. But so the tax holiday will be coming up as well. And just a quick reminder again, Red Cross, redcrossblood.org, go there. If you can give blood, they are still in desperate need of blood, and I think we'd really appreciate that. And that's my update for today, Steve.
Thank you, Plymouth State Representative Matthew Muratore. At this time, we're going to go directly to our questions. We're going to go to Ken Tavares. He's the chair of the Plymouth Select Board. Ken, we have two related questions. Mary first writes, what do I do about paying for next year's dump sticker since it runs out on Tuesday? And Russ says it's been taking 2 to 3 weeks to get the beach and dump stickers from the vendor the town has hired. Can we still use the email receipt to access the dump in the beach until the sticker arrives? Ken.
Yes, the answer is yes. The dump stickers have been extended to August 1st. And also the beach stickers, what you have to do is still apply for a new sticker, but just keep your receipt. If there's a problem with access, we can deal with them one-on-one. But if you have until August 1st to complete the transaction for the transfer station and the beach sticker, just go online now, apply for it, keep the receipt, and when you go to the beach, bring that receipt with you.
Thank you, Ken Tavares. We're now going to go back to our roundtable for closing statements. Going to begin with Dr. Phillip Triffletti. Phil, what do you want us to remember today?
Well, I also want to say thank you to PAC TV, Steve, for helping with this broadcast. Ken Tavares, kudos to all the panelists. It's been a great opportunity for me to come on and share my medical experience and knowledge, and I'm very grateful for that. And the great things are happening in the Plymouth community as well as the rest of the state of Massachusetts. Also want to thank Matt Muratore and our other government officials at the State House, the governor. I think they continue to do a great job for protecting us here in this state, and I'm very optimistic, going forward, how we're going to be doing it. If you look at the statistics now here at the United States, we're starting to see a real uptick in cases nationally. So, we're doing great here locally, regionally, and we'll have to just be wary of what's going on in the rest of the country. Then the last thing, of course, is just the standard things that we should continue to do that, we'll need to do for the foreseeable future. Wear masks, as has been pointed out, several times on these broadcasts. That's probably, the single number one thing for, preventing spread of infection. The social distancing, continue to do that as much as you can, and try to resist temptation to, have large, congregate activities. Wash your hands frequently. Do all these things, and I think we'll continue to be in a great position for controlling and reducing our community spread. And then the last thing, which I've said on most of the broadcasts, is that despite the challenges of the pandemic, that I would encourage you, instead of just counting the days, make sure that you make every day count. Thanks again, Steve, for having me on the show.
Thank you, Dr. Phillip Triffletti, attending primary care physician at Beth Israel Deaconess. We're going to go to Dr. Mark Wilson. Mark, what would be a good takeaway today?
I guess what I would like to remind everyone of is that we have a government that is listening to science and is being rational in its recommendations. And we recognize that it may be difficult, but we really have to appreciate how valuable those policies are in keeping us safe. And all you have to do is look on the news and see in locations throughout the United States where those policies of prevention haven't been followed, what's resulted. And so let's keep in mind, we're fortunate to have a government that's listening to science and reason and not emotion and politics. And I guess I'd also like to thank PAC TV. This has been enjoyable for me. I've learned a lot as well, and I hope the viewers have from those of us on the panel. But it's a testament to Plymouth and the people of our town that this event is taking place as often as it has, and I suspect it may be valuable many, many times in the future as well. So thank you for letting me participate in this.
Thank you. Dr. Mark Wilson, he's an active professor emeritus, University of Michigan, School of Public Health, Department of Epidemiology, and we're now going to go back to Chris Smalley. Chris, what do you have for us to close out today?
Sure. Again, just as I reiterated earlier, thank you to you, Steve, for this show and PAC TV and the great panelists that I've had an honor to be on with the last several weeks. I think, as Dr. Triffletti said and Dr. Wilson, it's practicing. We just need to be cautious with what we're doing. We need to live life, but we do need to be cautious. The wearing of the mask, the social distancing, the washing of the hands. All of that has an impact. We're actually seeing that happen with those numbers coming down. So even though it's nice weather out there, I think everyone just needs to be cautious with how they go about their daily life. And then I think in closing, on behalf of really the 2,000 incredibly dedicated nurses, doctors, clinicians, and employees at Beth Israel Deaconess Hospital, a big, big thank you to the community, to your viewers here on PAC TV for all the support that they've been giving everybody at our hospital every day, whether it's messages that show up at the hospital, lawn signs, or other types of nice things from the community. All of it has made a huge impact in the morale of all those 2,000 employees. So we thank the community. We're always going to be here for you, and it's a very safe environment to come to for care. So again, thank you, Steve, for this great show of yours the last several months.
Thank you, Christopher Smalley, Beth Israel Deaconess. We're going to go to our Plymouth Superintendent of the Public Schools, Dr. Gary Maestas. Gary, what should families remember today as they begin to think about returning in the fall?
I think the biggest thing that I can share with our families is, we're going to have a lot of information coming at them. We're going to be sharing stuff, but it's the most important thing is that we look at how we can manage and how we work together, because working together as we go through this next version of education in Plymouth is going to be, I know we're going to get impatient and we're going to want things the way they used to be and in a traditional setting, but we are going to get through this. We're going to get through it together. And I think the information that we share is going to be grounded in research. And second of all, it's going to be in the best environment that we can create for our students here in Plymouth. So I know things have been trying for our parent population, our student population. Our goal is to continue with a robust education that we have been working on for years here in Plymouth, and we will get back there. And it's going to take a lot of hands on deck to do that. Parents are involved in that mix. But I want everyone to know that we will be coming out with a series of correspondence and also videos that will kind of highlight the process as we go through so that they can be in tune and they can look forward to what school will look like in September.
Thank you, Dr. Gary Maestas, Superintendent of Schools. We're going to go back to our senior living consultant, Robert Eisenstein. Bob, as we reopen, seniors are still nervous and a bit fearful. How much, how little? What do you have for them?
Well, I was looking back over my notes. I think the point is we've come a long way. We really, back from the days where we had multiple cases, positive cases, unfortunately people passing away, to now the majority of nursing homes are COVID-free. I think the lesson that is learned is there's safety in the facilities now. And I think it's through the collaboration of leadership on multiple levels, Steve. Similar to our panel, which I think is representative of what's going on in this state. The collaboration between the local level, the State Department of Public Health, I'll even throw the federal government in there. And seriously, it's been a strong collaboration to make sure that we're providing leadership to make sure that these facilities are safe. And what I would tell the public again is there is transparency here. If you're concerned about a particular incidence of COVID in a particular nursing home, go online, check them out. We have a lot of good news to show there, but you do have to check it out. And it is incumbent upon all of us to make sure we get continued funding and that we're rigorous and insisting that all the actions that we've taken are going to be permanent. And then I think in the long run, we'll all be better off for it. And thank you again for letting me participate, Steve.
Thank you, Robert Eisenstein, Senior Living Consultant. Stephen Cole, with each update, we've combined a health segment with a business segment. And that was on purpose because we felt that business and the economy needs the health and the science. And what do you want to say today as we close?
Well, thank you, Steve. I appreciate the opportunity again, and thank you for this opportunity. Throughout the, to kind of give some closing remarks, throughout this ordeal, we at the foundation have tried to engage businesses and to try to engage our community to safely participate in the economy, at least to the extent practical. We had a couple of programs that we ran, including the gift card giveaway, the beard competition, which goes until the end of the month. So if you are interested in possibly winning a $50 gift card to a Plymouth-based salon of your choice, send to me a picture of yourself, either as a before and after, or just whatever crazy hair or beard you have acquired over the course of this competition. We are still getting out those gift cards. A couple of businesses have closed in that time frame and are starting the process of reopening. So I'll thank folks for their participation throughout this and beg them just one last time for your patience as we get out those cards. And lastly, Steve, if anybody is interested in starting a business, or if you've been spending this time thinking about the type of a job that you would like to have, or the type of job that you would like to create for your friends or family, now's the time to put that pen to paper. There's an awful lot of liquidity out there for new types of businesses. And so I encourage folks to be entrepreneurial. You've already been a bit more innovative and entrepreneurial than you probably realize. So reach out to the foundation. We're here to help. And thanks for the opportunity, Steve.
Thank you, Stephen Cole, Plymouth Regional Economic Development Foundation. Plymouth Representative Matthew Muratore, what's your closing statement today?
You know, Steve, when we started these shows, you're right. We really want to get the economics and the public health aspect on this show and get information out. I think we've done a pretty good job with that. You know, and we've always been, you know, continue to thank those that have been taking care of our physical health and those have been taking care of our economic health. And, you know, we just need to remember where we've been these last 3 months as we move, when we begin to move forward, as we begin to, you know, open stage 2 of phase 2 this week. And as we begin to open phase 3 on July 6th. And then when we open up in August, we just can't forget where we've been. And as both physicians have said, you know, just continue wearing those masks. That's what's made a difference here in Massachusetts. I've been asked a number of times over the last several days, you know, are you concerned or is the governor concerned with what's happening in other states where the cases are rising? And the answer is no, because we understand the public health aspect of this. We also understand the economic aspect of this, and we've been able to balance that. And the economic health will come back, but it will come back because we have taken care of the public health aspect of this, and we'll continue to do that by wearing masks, not just to protect ourselves, but to protect everyone else around us. So continue to be informed. You know, stay informed by going to mass.gov/COVID-19 or //reopening. You can ask questions by calling 211. You can text COVID-MA to 888-777, or in Spanish, COVID-MA ESP to 888-777. Or if you have health questions, go to bowie.com/mass. So just continue staying informed. You know, continue staying calm, doing what you've been doing all along to keep the numbers down. And let's just keep coming together by working together.
Thank you, Plymouth State Representative Matthew Muratore. Thanks to all of our panel, Dr. Phillip Triffletti, Dr. Mark Wilson, Christopher Smalley, Dr. Gary Maestas, Robert Eisenstein, Stephen Cole, and we're going to close out as we do each day with the chair of the Plymouth Select Board, Ken Tavares. Ken, how would you like to finish today?
I'd like to finish by saying thank you, and in particular to the panelists that are with us today. You and everyone that has come on this program have been extremely helpful. I know we probably haven't said thank you enough, but it is so appreciated what you've done. This won't be the last time we'll see you. I expect that we're going to be coming back to share the good news and to celebrate the victories that everyone is working so hard on. This has been difficult, and I realize that it's not done. It's not over yet. We still have a ways to go. My granddaughter reminded us yesterday when she was in our house that this was the first time she had been back in the house since March. And it just didn't seem natural, and it was wrenching, you know, to hear that. But we've made good progress. We've worked on this on multiple fronts, and I think it's because of every one of you and people that are beside you and behind you that are making things happen in a very, very positive way. Thank you. I look forward to sharing the good news with you very soon.
Thank you, Kenneth Tavares, Chair of the Plymouth Select Board. On Monday, we'll be joined once again by Sarah Cloud, Director of Behavioral Health at Beth Israel Deaconess. Also, Tim Cruz, the Plymouth County District Attorney, Michael Jackman, District Director, Congressman Keating, Heather Cosby, CPA, Michelle Brady. She is the Director of Elder Affairs in Plymouth. Amy Naples, Plymouth Area Chamber of Commerce. Also, our newly elected state senators, Susan Moran. They'll be joining Matt Muratore, Ken Tavares, and me on Monday at noon. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.